Yeah. My son got sent. We were visiting. And the weather was nice, but actually it was raining. And it was as soon as it was over.
I don't know. Change it back.
Yeah.
So everybody should be here. Yeah, through the app. Oh, it's already on recording, so it's already recording. It says stop recording. So we can start whenever you like. Yeah.
I think we can go ahead and get started. Good morning, everyone. And thank you for coming to this meeting of local emergency planning committee. So, Chief, do you have any remarks or?
Thank you, Joe.
Yeah, Tim. Okay, so we can go ahead and go to the next for MEMA update.
I don't have a ton anyways, so it's all good. All right, good morning, everyone. Sorry for the delay. It's kind of, you don't know what you're gonna get when you're driving in from Worcester, so it's a little crazy this morning. So MEMA updates. We don't really have too much that's changed from last month. I know I did mention the Mass Maritime interns. They are still looking for some. Our next emergency management directors meeting is on March 19th in Franklin. I guess it's also a hybrid meeting as well, so I'm not sure if you would have responded to that or who was going to be coming, but that's something that we do quarterly for all of the EMDs across, at least across our region for MEMA East, just to kind of give updates. And we also usually like to have some presentations from folks that have maybe recently had some sort of incident or disaster. So I believe at this particular meeting, we're going to be hearing from the folks, I think up in Salisbury, because they had a lot of damage with one of the more recent storms that we had in the last month or so. In terms of our CERC, the State Emergency Response Commission, I believe their next meeting is this Wednesday. We do have a few upcoming exercises that we're participating in. I think it's every so many years, I think 2 or 3 years, we're required to do a drill with the Seabrook nuclear power plant. It's actually a federal requirement. And since the state has 6 towns that are technically within the emergency planning zone for Seabrook, we basically have a drill. We get 2 practices and then a graded. The graded one is the one that's going to be coming up within the next few weeks. And it's just sort of exercise where they activate all the EOCs and test the responses, all those different things. So it's a really quick, sort of a small problem, and then they've nuked the plant within about 2 or 3 hours, and then we all get to go home. So it's just one of those things where we're trying to display our capabilities, that if something were to happen, we can evacuate the towns, we can deal with the school children, all of those fun things. As always, we have training available. TRS is the way to go to sign up for those. Some of the classes that we have coming up next week in Franklin, basic shelter operations. That's always a good one. A lot of the ICS 300 and 400 classes coming up, as well as some WebEOC classes. So if there's ever anything that you're interested in, you can always use TRS to sign up and take those. And I know you've been taking advantage of quite a few of them lately, so we like to see that. That's definitely a good thing. Any questions for me? All right. All set. Great. Thank you.
Thanks.
So next on the agenda, we have a presentation from Needham Public Health to present on their insight in tower response to the opioid response. So I am going to open the floor to the team.
Please help.
Yeah.
Yeah.
Good morning, everybody. Let's share. I'm gonna put up the Q&A in case people have questions. Oh, I don't want that big. All right. There's a fancy on the screen.
Yeah, so nice. Good morning, everybody. I'm Ginny. I'm one of the Needham Public Health nurses. Obviously, we all know Tiffany.
Tiffany, Assistant Director of Public Health.
I'm Kelly. I'm the regional public health nurse.
Right, so we're just going to talk about our response to opioid overdoses here in Needham and review our sandboxes. So we're just going to go over our different opioid types, the current landscape in Needham and the region, Narcan and what sandboxes are. We're going to go over the community Narcan program, where we plan on putting the sandboxes and how to use them, recovery coaching, and how we're going to use opioid settlement funding. So as far as different opioid types, there are natural ones, including morphine and codeine. There's semi-synthetic like oxycodone, hydrocodone, methadone, which is a synthetic opioid that's a prescription medication. Synthetic opioids other than methadone, like tramadol or fentanyl. And there's also heroin, which is the illicit, illegally made opioid synthesized from morphine. So as far as opioids in the nation, there's nearly been 645,000 deaths between 1999 and 2021. And there's been 3 waves that the CDC has found. So in the 1990s, there was a marked rise in prescription opioid overdoses that included natural and semi-synthetic opioids, as well as methadone. In 2010, there was a rise in the use of heroin overdoses. And then in 2013, we've seen a marked rise in synthetic opioid overdose deaths, including with fentanyl. And this is just a different way of seeing the data that I just had in the last slide. And then this is the EMS regional opioid dashboard. So this is just the response of EMS to opioid overdoses. It doesn't mean that they're all fatal or resulted in sort of death. We only have the 3 quarters of 2023. And in Needham specifically, we've had 11 responses. Next. Yeah.
Okay.
So this is Narcan. I'm sure we're all familiar with it. Narcan's an opioid antagonist, so it binds to the opioid receptors, and that's how it reverses the opioid overdose, but it is a temporary treatment. And it's given in the nose, in the muscle, under the skin, and through IV, but primarily we're giving out the nasal because this is more user-friendly. And then this is just the naloxone administration in region 4, and it's broken down by age group. So as you can see, EMS responded to these different age groups, and at like 58%, they've responded with opioids overdoses for 15 to 24 and so on.
Next one. So just to let you guys know kind of how we came about Narcan in our office, we applied for a grant 2 years ago for BID Needham. and got $900 to be able to buy the Narcan and then start supplying it with to the residents. We teach them as they sign up about what Narcan is, how to use it, and then provide them with a free dose, anybody 18 and older. But now we've switched to the community naloxone program. So that's done through BSAS, which is a subset of DPH. And they will provide us, because we are public health, a subsidy for free of however much Narcan we need. So we have to do reporting guidelines for them, which just includes like how many doses we've given out, how many trainings we've done, and whether or not we've had feedback from people that they've used that. My understanding is that number has been pretty low. We don't tend to get people come back and saying they used it. But this program is awesome, and there's a bunch of different qualifying groups that qualify. So the list is on the website there, but if you qualify, they can do a partial subsidy. So you still have to pay for some, or they'll do a full subsidy depending on your program. So lots of people can do it. I think it's mostly local government type groups and or nonprofits that can apply for that program. Super easy to apply for. Ginny just wrote up an SOP real quick. We had to do a training with them, and then that was it. And they're super nice. They gave us some trainers that we could utilize to teach people with as well. So yeah, it's been a great program. They said even if we do a large training with people or go to some big meeting, they provide us with a large bunch so that we can hand it out to people at once. It's an awesome program. So yeah, just wanted to put a plug in there for that one as well.
So Sandbox, Sandbox is an opioid harm reduction initiative that brings education and awareness. Sandbox contains Narcan, directions for administering the Narcan, CPR, breathing barriers, as well as gloves. So this is what a Sandbox looks like. It'll usually be placed right next to the AED and the CPR, or the first aid kits. Where will the Sandbox be placed? So Ginny and I went around to the town buildings just to assess for size, population, and how many AEDs they currently have in the building. So with that information, we decided where the Sandboxes will be going. So there'll be one in the library, one at RTS, one at Cath, 2 at Rosemary, 1 at PSAB, and 2 at Town Hall. So why do we need Sandboxes? The opioid epidemic affects everyone. In Needham, annually, there are 1 to 3 opioid-related overdose deaths between 2015 and 2022. Having the Sandboxes also just empowers residents. If they know what Narcan is and how to use it, they're more likely to act if they see someone who's experiencing an overdose. It also makes Narcan more accessible to the community. It destigmatizes substance use disorders and increases the likelihood of survival if we have Narcan readily available. So just a quick Narcan training, just to go over the signs of a potential opioid overdose. The person may have pinpoint pupils, they may have cool or clammy skin, they may appear blue, and someone with darker skin, you want to check their nail beds and their gums for any blue coloring. They may have irregular breathing as well. So the first thing you want to do, similar to CPR, is check their responsiveness. You can tap them on the shoulder, ask them if they're okay. If they don't respond, you call 911, and then you can administer the Narcan. So it's similar to a nasal spray, like a Flonase. So you just put it up in either nostril and give it a squirt, just in one nostril. And then after you give it a squirt, you can turn them on their side, and that's called the recovery position. We usually say to take a step back after you administer it. People can sometimes be a little bit agitated after you've just taken away their high, so you just want to take a step back for your own safety. And if at any point breathing stops, you want to perform CPR. So the Good Samaritan law, this applies for CPR as well, or Narcan, but you cannot be sued if you perform CPR or give Narcan if you're acting in good faith. So the person can't turn around and sue you for doing that. The overdose assistance law just states that a person, either for themselves or for someone else, cannot be charged with possession of a controlled substance if you're seeking medical care for an opioid related overdose. Either again for yourself or if you're seeking for someone else. And any person can receive a Narcan prescription or administer it.
Some of one of the other things, and I'll go into the opioid funding, settlement funding stuff after this, but I touch on the peer recovery coach services that we have. That's also partially response to the opioid settlement. So we have requested the use of opioid funding to be able to hire a peer recovery coach. Many of you may have already seen this. We've done a presentation to a couple different groups. The key goal of peer recovery coach is somebody that has lived experience with substance use, that can be a peer to the people that are either curious about their substance use, curious about recovery, curious about what to do after recovery. So they're there kind of as a companion to help them make choices that are best for them. And the difference between a peer recovery coach and a clinician, as you can see by the table up there, is that they have experience, that it's within the community. She goes and meets them where they need to be met. And then it's more of an open-ended question type relationship, and there's no power differential there, because with a clinician, it's often somebody trying to determine what's best for you versus this, you determine what's best for yourself with that person. So kind of just a little bit of difference with a peer recovery coach. This displays the traditional pathway that it used to be for substance use treatment, detox, sober living. You can do in-person support, but now the new kind of paradigm is having that peer recovery coach helps them choose what's best. And one thing that our PRC says is that it's not always to quit that substance, which is best for them at this moment in time. So helping them determine what route works best for them to then be able to feel comfortable to continue on in a treatment like type area for them, whatever it may look like. So with all of this, the opioid settlement, do a quick snapshot on this. For those who may not know, on your guys' right over here is how much Needham is going to receive currently from the opioid settlements through all the different groups. We have received, unless it's changed, as of last summer, 217, a little over 217,000. And so far, even though on this chart it says year one payment, everybody below Teva and below, except for J&J, has not determined what their year one is. So that, according to the state, has not come out yet to us. But the opioid settlement funding for the things we're allowed to use it are those 7 things right there on the left. And I'll kind of go over to which ones we've chosen to use at the current moment and how we're utilizing them. So what we're doing currently with opioid settlement funding is 90,000 is going to contractual help. They're going to help us. Well, one has already been in the thick of it. We're working with community groups, done key stakeholder interviews to kind of tell us what it is we're seeing opioid needs, what people in the community need, what people in recovery need. So they have met with stakeholder interviews, small group interviews with people with lived experience, and our next step is a community education forum. And then we work with the other group, EDC, and they will take that data and make a strategic plan with a yearly evaluation plan so we can continue to look forward and see if what we're doing is helping or if it needs to be adjusted. So that's one part of what we're utilizing some of the money for. Then the sandboxes, $3,000 towards that. We were able to buy 11 sandboxes, and then we got 4 from the DA's office. So we have 15 sandboxes, but what we put on that Kelly showed you where they're going to be placed, that's only 8 of them. So we're saving 7 of them for after this process to see if there are any community groups that think they would like one, or any other building type places to put them before we continue to put them out at town buildings. And then $58,000 was saved for the peer recovery services. So we have a part-time peer recovery coach. Her name's Angie McDonald. She is started her peer recovery in January, like January 2nd. Has been pretty responsive, has received several referrals, meets with several different people. She's doing a great job. She is also providing us feedback of what those people need as well, which will be helpful for our opioid response also. So what's to come with all of this? The next big thing that I'm putting a plug in for April 10th at 6:30 at Powers Hall is going to be our community conversations. And there public health will be giving conversation and discussion about opioids and what we're seeing in the community. And then our contractor, RVA, will come in and talk to us about what they've received feedback from, what the biggest needs we're seeing is. And then we'll break out into small peer groups, and have more discussion on that. It will be broadcasted by Needham channel, at least the first part before we split out in small groups. So, if you want to watch it on the Needham channel as well, it will be there as well. Here's all our sources, and then Angie McDonald's information is there. The Scan Me QR code is just a basic form. If you want to refer somebody, you can just ask for information, name and a phone number so that you can contact them and get information and go from there. I think that's it. Oh, the thank you didn't come up. Sorry. I was supposed to say thank you. This is the blank screen. Yeah, any questions? I don't know how to do the chat on this very well, so if anybody on Zoom has questions either, let us know.
We have the sandboxes in this building? Are they?
So,
I did email both chiefs and I didn't get a response. My hope was that we could get one here. I know it's ironic that, you know, somebody wouldn't come in here to get Narcan in the police and fire building, but I mean, it's kind of a choice, like, are you going to let someone do go into an overdose death? Or are you just gonna grab it and go? Because they're not gonna just get you in trouble for saving someone's life. So I'm really hoping we can get one here.
we were thinking too to place it outside, but you can't really keep it outside because of
Yeah.
the weather, unfortunately. Because I think that would be ultimate for a lot of places, is having it outside. But we haven't figured out how to solve the weather concern with that, because it has to be within comfortable temperature range, or else the Narcan doesn't work.
We do also worry a little bit less about the building, given that we have a whole bunch of first responders that have.
Yeah, but if they're all out and dispatchers, do dispatchers have them?
That's a good
I
question.
don't know.
Question.
No, John is saying no. Yes,
Just a comment that I can see the sandboxes in restaurant bathrooms. So not that we get like a buff and nightlife in Needham, but I just, as just a layperson, I've been seeing them more and more when I come up.
I appreciate that. Some of the things that we are getting from our quick anecdotal data from RBA is one, the destigmatization of Narcan is one that really needs to be pushed. The destigmatization of opioids in general, but especially they say if you focus on the Narcan, it seems to help people understand a little bit better about why it's needed. So that is one thing we're hearing. You know, transportation needs to meetings are another one. Potential for helping parents go to meetings, so childcare of some kind so that they can get there. Another one is the need for funding to pay some bills. Sometimes it's bills to the judicial system, sometimes it's bills to other places, but they can't pay those bills because they're working to be able to pay those bills, so they miss their meetings type of process. And there was something else I was going to say about that. Oh, and then some other basic ones are resume reviews and interview skills and things like that, that they've kind of dropped off. We were able to go speak with Moore, if anybody knows who that is. It's Massachusetts office. I'm going to totally butcher that wrong. I always say it wrong. What is it? It's a group out in Walpole. They're in Walpole, based in Walpole. It's a sobriety run type group where they have meetings and things like that to help people in substance use. So we were able to connect with them and go to one of their meetings and do questions and have a small peer group discussion. I think there was 13 people in attendance. And they really said to think outside the box, because the traditional ways don't work as well as people think they do. So they're like, think outside the box, do something different with this funding. Not just another, you know, whatever a normal response would be, not trying to get another social worker or open up a meeting group. What is something different that we can provide? So I thought that was interesting. So we'll keep gathering a little bit more data from this community forum on the 10th of April. And then we'll have a finalized report a few weeks later, kind of what that looks like for people and what we've been seeing and gathering data from.
there a minimum age to be trained in Narcan?
No, so actually the CNP program says do anybody. They say children as well, if we have teenagers come to train them. We are, before we roll that out though, working with legal just to make sure that that's okay.
Cause
But-
cause our CPR classes are 14 and over and we teach it in there. We just don't give it out for 18 and
I
under
was
yet.
thinking about some of my camp staff or cool staff.
Oh, sure.
Yeah,
Yeah, absolutely.
Because it can happen anywhere.
Yeah, especially because
Yeah.
we're gonna have sandboxes both downstairs and upstairs. Absolutely. We're
Mhm.
happy to teach them. Yeah. Any other thoughts or questions? Our presentation went way faster than we expected to. So we talked quick. No, all right, thank you.
They're just not sharing.
Yeah. Stop sharing. Yeah, so for emergency management division, last month we have been busy. So we have been working in several key components. So I divided my updates in several sections, and I am going to highlight a couple of sections. The first one, we already finished the drafting request for a vendor to run to lead our emergency operations center function exercise, which is in June. The second one, which is related to the first one, I start going through the after action report, the improvement plan from the last year exercise. And there is 20 improvements we need to cover. So I start working through of them. The third one, it's about the storm ready certification. We completed our application and submitted to National Weather Services along with a couple of plans. So they are going to review them and reach back to us, and we take it from there. And I am happy to answer any question regarding the other sections.
Always run into the challenge of not everyone being awake on Monday.
Yeah. Yeah.
What exactly is storm ready certification? What would that mean to the town?
Yes, thank you. So Storm Ready, it's a program through the National Weather Service. It's a straightforward program. It's cover 4 sections: communication, covering operation, and covering the warning section. And the first one, it was about like the town information, like about the AOC and all this. And along, we need like to submit plans about, like, we submit the SAM, we submit our multi-hazard mitigation plan, and the lighting plan. So they send me like the format, we fill it out, and they are reviewing that. And the big benefit of that, when they agree, like they provide us the certification, we are going to get like a discount for the flood insurance through the FEMA. So this is a big benefit. Yeah, and the other benefit, prepare us, like to figure out, like to see what we are lack of, so we can prepare for any kind of natural emergency. Yeah. Oh, yeah. Okay. Thank you for coming.
Thank you, Joe.
Yeah.
Stop.